Right now, perhaps it's time for our expert segment. And today we have Dr. Rajan Ravichandran, who is a nephrologist and the founder of the Sapiens Trust. He has, over the years, looked at salt consumption as the biggest enemy of people who develop hypertension. So, without any further ado, we go to Dr. Rajan Ravichandran. Hello, Dr. Rajan Ravichandran. We are happy to welcome the inaugural guest for our video podcast.
Hello, I'm also happy.
We're going to be observing World Hypertension Day on May 17th. And
Right.
as a nephrologist and even outside as part of Sapiens, your organization, your NGO, the Trust, you've been doing a lot of work with regards to salt consumption in the population, basically looking at lowering hypertension. So would you like to talk about the work that you've done, and then we can follow it up with maybe a couple of questions?
Brief introduction. You know, the number one killer in the world is hypertension and its complications, heart attacks, strokes, and kidney failure. So basically, it is because of the hypertension leading to an endothelial damage to the blood vessel lining that leads to reduced blood supply or clots or whatever it is. So that leads to an organ dysfunction. So the most important cause of hypertension, people are not aware. They still think it is probably stress. So stress only transiently elevates the blood pressure. But what keeps a sustained high blood pressure is the salt intake. And Indians are consuming almost 2 to 3 times of the salt which WHO recommends for an average adult to consume per day, which is 5 grams of salt. And Indians consume anywhere between 8 to 12 grams of salt per day. So almost 1/3 of the adult population in India have hypertension, if you measure it. But if you don't measure also, you may have a blood vessel damage in a larger group of patients. That's why you see both hypertension, strokes, heart attacks, and kidney failure. We are one of the leading countries which have these morbidities. And realizing the importance of reducing salt in the population, that is the single most important, most cost-effective measure which can prevent the complications of hypertension. And we started this in 2010. We started with, of course, creating awareness by having walkathons in the beach, releasing videos, posters, and subsequently we had the first conference on salt consumption in 2017 with IIT Madras as well as in IIT Mumbai, where we again involved a lot of international speakers to highlight on the importance of salt consumption and hypertension. After that also we have been writing to food manufacturers, more than 300 food manufacturers, asking them to again reduce use of salt as a preservative for packed or packaged food. And recently, with the resolve to save lives, we have been organizing conferences for physicians. First, what we found is that physicians themselves are not aware on the importance of salt, the relationship between salt and health. I would say not just hypertension, salt and health. And so we had 3 conferences, one in IIT Madras in June 24, then one in Mumbai in December, and one last month we had it at Delhi. So this is again to educate physicians on the importance of salt and health and how we can recommend to patients to consume less salt.
Right. The recent recommendation to reduce the sodium content, the WHO recommendation to have low sodium salt, replace the salt that we have on our kitchen tables. How effective do you think that will be?
So first, I would like to clarify or what you call misconception, in the sense that a lot of people think alternate salts are salt substitutes. They are not. For example, you have in the market like rock salt or Senda Namak, Indupu, or Himalayan pink salt, etc. All these of them contain still the sodium. So when we talk of low sodium salt substitutes, we talk of a situation. See, sodium is the cause of the ill effect of salt on the blood pressure or the blood vessels. So we have to replace part of the sodium with another salt. And the most important, the cation which has the opposite action of sodium is the potassium. So the low sodium salt substitutes are where potassium replaces the sodium by about 20% or even up to 40%. So you have, instead of sodium chloride, you have part of it is potassium chloride and part of it is sodium chloride. This way you consume less. This is the guideline which the WHO is talking of, is the low sodium salt substitutes.
Right. What about, let's come to diagnostics, doctor. What about testing oneself periodically for hypertension? Do you do it only after a certain age, or is it to be part of your annual checkup?
I think every opportunity you get, you should record your blood pressure. By that, what I mean is, for example, children, often the blood pressure is never recorded. And in a study we did in college students, we found that 10% of the college students had hypertension and they were not aware. Imagine 10% of young students who are at the age of 16 had hypertension. So it is an issue even in children. So at every possible opportunity, when you go to a general practitioner for some other illness or whatever it is, a blood pressure recording should be made. Same way, while recruiting in jobs or seeking admissions, I'm surprised, of course, when you seek admission to the US, they ask for tuberculosis. They don't ask for hypertension. So, but I think this should be an opportunity at every screening point, like students, when you enter the college or schools, when you are entering a job, a blood pressure recording should be done, or you visit your physician for any other reason. For that matter of fact, what we have been doing is to distribute the electronic blood pressure instruments so that people can record their own blood pressures at different times. This will avoid the white coat hypertension. If they record it themselves at home, the blood pressure may be different than what we see it at the clinic.
True. Can I also ask you, doctor, to give our readers, our viewers, some small tips that they can follow in life, daily living, so that one can keep hypertension at bay?
So the most important, as I said, the important cause of hypertension is salt intake, obesity, alcohol, and lack of potassium in the diet. So if you look at the opposite actions, so first and foremost is, of course, people should be doing exercise. They should keep themselves mobile. Sitting in one place for long hours obviously is detrimental. So that is followed by obesity. So obesity is another cause. Third, of course, first I would put salt intake. So if you are going to take high salt intake, whatever you do, see, at this point you may be salt resistant, in the sense the salt may not, for example, two people eat the same salt. One person gets hypertension, one does not get. So this depends on the genetic sensitivity to salt. So you call it salt resistant. But this salt resistant can change with time. So today you may be salt resistant, tomorrow you'll become salt sensitive. So cut your salt intake. And you may not even know how much grams to take. Just reduce it by 10% or 20%. It's going to make a significant impact on your life. So first and foremost is the salt intake, which consists of avoiding preserved and packed foods and avoiding adding extra salt while eating food. So salt shaker should be removed from the table. Then second is exercise, as I said. Mobility definitely produces a vasodilation of the blood vessels and an improvement in the blood pressure. Reduction in weight or obesity, mindfulness of this thing. High potassium intake, very important. You should take fruits and vegetables. So that has an anti-hypertensive effect on the blood vessels. So these are the important tips are: reduce your salt, regular exercise, keep your weight under control, and take sufficient potassium. And of course, last but not the least is avoid toxins like smoking, alcohol. Alcohol is known to produce hypertension. Although the first drink may produce a vasodilation, over a period of time, alcohol produces hypertension.
Right, and with that, we come to the end of this segment. Thank you so much, Dr. Rajan Ravichandran. We are so glad that you could join us today, and I'm sure our viewers will have a great deal of information from this small conversation. Thank you so much.
Thank you very much, and it was my pleasure. Thank you.